Welcome back to Women in Oral Health. Today we're focusing on pregnancy. As we learn in school, and as many people know, pregnancy is not a disease. It's almost like having a flu. And so when it comes to dental care and oral health, we just want to modify our treatment to accommodate the mother, the expecting mother, as she proceeds and progresses through the pregnancy. This information is for expecting mothers, planning mothers, parents, co-parents, family members, friends, providers, just so that we can start to really have more communication and information that we feel comfortable conveying with our team of providers, and to encourage healthy pregnancies. And that's really where I start off. What's the best time for dental treatment? The best time for dental treatment is semester 0. So just like everything else, we want to go into that pregnancy healthy, and we want to go into that pregnancy with good oral health. There's a lot of information about x-rays, dental x-rays, and I will tell you, you want to feel very confident. The American Dental Association, the American Academy of Family Physicians, the American College of Radiology, they have all confirmed that dental x-rays are safe during pregnancy. The benefits fully outweigh the risks. In fact, the American College of Radiology has confirmed that no single diagnostic x-ray is going to cause adverse effects to the fetus. And so you want to go into that pregnancy feeling really good, right? So you want to already have an established dental office, you want to have an established home care regimen, and you want to actually be free of dental disease. You want to really be on a routine recare schedule. But things happen and people get busy. And so if you are going into the dental office during your pregnancy, what would be the best semester? Well, the best semester really would be the second semester in terms of dental treatment. The first semester is very sensitive. Often expecting mothers experience hyperemesis. They may feel nauseous, morning sickness. They may be uncomfortable. Perhaps they have finished fertility treatments. They may be going through other medical therapies. And so that first semester is really sensitive. Ideally, you already want to be in, like I said, you want to be in recare at that point. But if you had to go into the dental visit, it would be the second semester. The second semester, your pregnancy is well on its way. You're kind of found your flow with the pregnancy. And that third semester, we really don't want to have to do anything too extreme in that third semester. So the third semester, as you can imagine, you're bigger, you're less comfortable. Now, we can use dental modifications during your pregnancy if in the event you have to come in for emergency care. And, you know, we've all seen it. You could get an infection. You could have a, trauma and have to go in for dental therapy. There are modifications that we use. Of course, we could roll you on your left. The uterus is more comfortable. The blood flows more easily to the uterus. We accommodate our patients even when they're not pregnant. We have to, stand up, elevate your chair to make sure that you're comfortable. And that being said, in the event that a dental x-ray is recommended, then we want you to, again, feel comfortable that we have confirmed with all the organizations that dental x-rays are safe during pregnancy. A few key points on x-rays. Just think about the location of that beam. Everything that we need to provide dental therapy is above the neck. We're not even focusing on that abdomen. So the location of that x-ray, also the speed of dental x-rays. Hopefully you all are in modern dental offices and we use digital x-rays. The speed is so fast. I mean, even when you're not pregnant, a full set of x-rays, it's almost like walking out to your car. It's not even like sitting on the beach for 20 minutes. So dental x-rays are very safe. The other thing is that we don't even need you to wear like a lead apron. In the event you need an x-ray, we will make sure that you're physically comfortable, and we will get all the information that we need in order to treat you. So I just want you to remember that in the best case, we want to be coming from a prevention standpoint. So we already want you to have routine dental therapy. We want to have done the big work, before the pregnancy arrives. Like we want to have done all the fillings, restored all the teeth. Any areas that we were questioning or thinking about in terms of becoming troublesome, we wanted to already troubleshoot. We want your gums to be healthy going into the pregnancy. And that is a very big point. Pregnancy gingivitis, like it sounds like a weird thing, but it is a thing. It's a proper diagnosis. Now, There are degrees of pregnancy gingivitis, and this really comes from the fact that in pregnancy you have that surge. You have surge of progesterone and your surge of estrogen, and that will lead to more blood flowing to our gums. And so when blood flows to our gums, we may have swelling, we may have bleeding, In severe cases, you could see manifestation of gingiva that almost look like strawberry patches on your gums. And you may think, oh my gosh, is something wrong? That would be a time to go into the dentist and have a look. If you have an opportunity to do a virtual visit, perhaps show pictures to your provider that you've had an established relationship with, and talk about home care. Sometimes it's really just staying on top of your home care, because pregnancy is a window of time, but it is 10 months. So at certain times, you may need to be a little more thorough with your hygiene and understanding all those hormones are changing. Now, that being said, the surges of hormones are what create those symptoms of hyperemesis or morning sickness. Personally, my pregnancy, I had nausea with and without vomiting the full pregnancy. There were probably 3 days where I wasn't nauseous, and I worked up until 2 days before my son was born. When I would drive to work, I would have to pull over and relieve myself and vomit. I was eating. My saliva was intense. I almost felt like a lion. Like I was just eating and hungry, and I had hypersense of smell and taste. Everything. I had these extreme changes, and so I can appreciate that pregnancy is it's an interesting time for expecting mothers, and every pregnancy and every woman, each of us are different. My mother had 4 of us, and she'll tell you, all 4 of her pregnancies were unique, and every experience that you have will be unique. And so what's important is that what's standard is that you have a relationship with a dental provider and that you have home care. And so within that window, we can modify things to make sure that you are able to have a healthy pregnancy and maintain good oral health. And so let's go back to the morning sickness. Morning sickness, it could be just nausea with vomiting. It could be nausea without vomiting. It could be reflux. Sometimes, especially as the uterus grows and puts pressure on the stomach, you may feel heartburn and you may feel regurgitation. Any of those symptoms can result in more acid rinsing into the oral cavity. So acid is bad, okay? And so when that happens, we want to be very sensitive to not brushing our teeth and not creating more damage to our dental tissue, to our enamel. Enamel is very porous. So under a microscope, you're going to see that it's not just one surface. It actually has striations. It has pores. It's like a crystal structure. And so when acid rinses in, it actually, the pores open up. The saliva is not there to neutralize that acid. And so our teeth are in danger. So if you are vomiting, you notice a lot of regurgitation or acid coming up, you want to rinse with water. This could be tap water. Rinse with a fluoridated mouth rinse. There are several mouth rinses that have fluoride as well as antiseptics. You may see cetylpyridinium chloride. Those are good. Let that come into your oral cavity, but don't brush your teeth. You could put toothpaste on your tongue, but again, don't brush your teeth. You want to wait about 30 minutes, 20 minutes so that the saliva can neutralize things. And then, as needed, brush lightly and go about your day. Like I said, when I was pregnant, I had a lot of saliva. I was eating. The first 3 months I was hungry, and honestly, you're generating a baby, so there's a lot to do with digestion, and that's why we have that saliva. I think it's everything is working together, so that saliva helps with digestion. But if you're eating, you're snacking all day, you just want to think about the fact that you want to be brushing your teeth periodically to keep the cavity risk low. So we talked about pregnancy gingivitis, our teeth. We talk about the risk of erosion from the acid, reflux and vomiting, nausea, all of those symptoms of heartburn. And so that's why it's important to think about minimizing your risk. As I said, every pregnancy is different. Some women may notice, they'll say later on, oh, the baby, he pulled all my nutrients from my teeth. And what that means is that some women, whether it's calcium levels, whether they have anemia, your general health, is a little different. Like I said, pregnancy is not a disease, it's like an illness. And so with that, your teeth may be more prone to erosion. You may have dry mouth from other medications that you're taking during your pregnancy. If you have hyperemesis or morning sickness or what have you, you may be losing protein levels. And so all of those side effects, have implications in terms of your oral health. And so that's why it's really important to have that communication with your whole team. Essentially, your dentist is part of your team. We want to be there to know the information that your OB-GYN has given you, the things that you're looking on your dashboard if you are planning to get pregnant, so that we can help you meet your goals and keep your smile, because we want your smile to carry you through the pregnancy. We want you to enjoy your pregnancy when the baby arrives. And that leads me to another thing, cosmetic procedures. Okay, everybody, we see all these pictures of moms with the new baby and they look gorgeous. The makeup artist came in, the lighting's perfect. Your teeth will be fine, okay? We don't want you doing any teeth whitening during pregnancy. Really, that's the rule. Every woman is different, but generally peroxides, they can get into the bloodstream and they can get into our breast milk. So even when you're nursing, you want to talk to your doctor and your dentist about any type of cosmetic dentistry that you want to pursue to have your best smile. That being said, they're natural whiteners. Pineapple has an enzyme called bromelain in it, and it naturally whitens your teeth. It naturally removes the plaque. Strawberry are a natural teeth whitener. And there's just so many things. It's really about making sure that you've minimized your risk for all these things like the gingivitis and like the decay that can give you a less harmful smile. Finally, I wanted to really talk about two things that we don't really think about in terms of our oral health. But number one, fatigue. I was sleeping, I was napping all day I would go to work, come home, sleep, and then at 11 o'clock, I wake up and just go to my bed. I was so tired. They say pregnancy is like running 7 miles a day. So for all the runners out there, shout out to y'all that just naturally like to run 10 miles a day, but you're carrying around a baby, it gets bigger and bigger, and so you're tired. And a part of that also, you're nesting. You're thinking about everything else under the sun, not your dental health. You're not over there flossing, more particularly during pregnancy. Let's be honest. If you're falling asleep and you've eaten, you took a snap, you're not brushing your teeth right before you go to bed. So we understand all of that, but we want to minimize emergencies. And so, like I said, what's the best time for dental treatment? We want to make sure that you're going into the pregnancy healthy and that you're on a routine recall. So we want you doing cleanings as necessary every 3 to 6 months. But if you do have an emergency, we want you to come in and see us, okay? Orthodontic work is safe during pregnancy. Again, your pregnancy is going to change a lot of your body. Everybody knows certain parts of our body, from our pubic symphysis, our rib cage, our bones change. We're real flexible. And so you may notice that your jaw resorption, maybe your teeth are a little more crowded. You're like, I didn't notice that before the pregnancy. But also, if you had orthodontics before, relapse is more pronounced during pregnancy. And so we want to make sure you're wearing your retainers. And again, when you're pregnant, you're not prioritizing your retainers. You're not prioritizing all these little things that you were doing before you were worried about 11 things in the baby. Also, if you're a new mother, that's one thing, but you may have other children at home. You're providing care for all these other people. And we want to make sure that we keep that communication open, because we understand. I was a contractor for the military in Germany, and I had so many mothers, military wives, who told me they didn't brush their teeth during pregnancy because they were so nauseous, and brushing their teeth made it worse. And of course, I'm sitting here thinking, oh my goodness, why did you do this? But then when I had nausea during my pregnancy, I just had so much empathy. I totally understood. But there are other things you can do. You can think about perhaps fruit flavored toothpaste. Sometimes mint, enhances nausea. Also, holding your breath when you brush, just because when you hold your breath, you may not think, so much of the vibration where the soft palate is. And the other thing is not brushing too far back. Just brush in the front and spit out and go about your day. Okay, at least you're going in there every so often. I want to talk about grinding. Now, pregnancy is stressful, right? We all want to be left alone in a cave to have that baby, but pregnancy is stressful. So you may be grinding your teeth. You may be clenching excessively. Not every pregnancy is easy. There's some women who have to be, have bed rest throughout their pregnancy. You may have severe nausea. You may be in a hospital setting getting IVs. So stress is just part of the game. So with that being said, we want to know if there's anything we can help you with in terms of night guards, in terms of exercises, things that can relax you to take the stress off of your teeth and jaw. Often, you're going to get through that pregnancy, get the baby out, healthy baby, and then later on, you might notice my my jaw hurts, or I got lockjaw. I had a patient, her baby wasn't even 1, and she was in the emergency room with lockjaw. She had so many things that were stressing her out, and ultimately she didn't have the right night guard. She didn't understand how much stress she was putting on her jaw. And so that's why we want to talk to you about all these things that can be done so that you can be healthy and happy and comfortable when your bundle arrives. The other thing I wanted to talk about is dry mouth. And dry mouth could be a manifestation of our hormones, but it can also be a side effect from medication. So again, pregnancy is not a disease. Pregnancy is an illness. They say it's like a light flu. Now, every woman will argue with her provider about whether that's true or not, if it feels like a light flu. But again, it's your overall health and what type of side effects certain medications may cause in your mouth, okay? So the key takeaways in terms of pregnancy and oral health would be the best time for dental treatments, dental considerations for your pregnancy, and home care, okay? So home care is important all the time, but especially when you're pregnant, we already want to have that established home care regimen, and we want to know things that may make it difficult so that we can give you more information to pursue your best smile. I know that a lot of people don't even know that nausea, actually acid, causes cavities. So we're thinking like, well, why would acid? That's not connected to bread or pasta or rice, but stomach acid that rinses up, all that acid also can erode our teeth. And what we see are commonly erosion at the gum line. So when the gum line, has that little, it technically has a butt of enamel, and erosion will thin that enamel, soften that enamel, and we will often see cavities. Sometimes those cavities don't manifest till months after the pregnancy. And so that's another reason why we want to be conscious of our behavior during the pregnancy to prevent these problems from manifesting later on. See you next time.